you diagnose yourself as having a problem? So I personally don't like the word infertile or infertility, and you might have noticed that from the way I choose to express myself. The reason I don't like it is I believe it carries a lot of negative connotations, and it's harrowing enough to realise that you might have a problem trying to have a baby, what seems like such a basic human right, without having the negative connotations that infertility carries with it. So I tend to choose to refer to this as subfertility or being subfertile, and I'd encourage you to use the same term. I just think it breeds more positivity into the whole area. So when do you know that you might have a problem? Well, this can be a little bit tricky because it depends on the age. As a general rule of thumb, around 60 to 65% of patients should conceive after around 3 to 6 months of trying. And by the time it gets to a year, the majority of patients, so up to about 85%, should have conceived by then. However, this can vary depending on the age that you and your partner are at. So in terms of generalist advice, I would say that if you are 35 or under and have had a problem for around a year, then this is the time to go and see your GP to discuss some of the issues that you might be having, to see if he can start some basic investigations for you. If you are aged over 35, then I suggest you shorten the waiting period to around 6 months, simply because the chance of having problems is slightly larger the older that you are, so that your GP can start to undertake some investigations at this stage. Now, please bear in mind that just because you've been trying for 6 months to a year does not mean that there is anything wrong with you. And simply by going to a GP who can address your whole holistic situation and take your whole history and do a physical exam might be enough to reassure you to continue to try. There's nothing wrong with continuing to try for sometimes 1, 2, even 3 years. But you do need to go and see someone in order to have this basic level of reassurance. The only other thing I will add to this is if you have any chronic condition that might potentially affect your fertility. So if you are diagnosed with something, for example, like diabetes or polycystic ovaries in the past, then you might wish to go and see your GP shorter than 6 months to a year to start undertaking some basic investigations. Thanks for joining me.